George Armani, 56-year-old patient comes with back pain. Your time starts now. Yes.
Hello, Mr. Romani. I'm Dr. Nestor, and I will be taking your history and physical today. Let me drape you first. Thank you. So, Mr. Romani, what brings you to the hospital today?
Doc, I have this back pain.
Okay. Since when are you experiencing this back pain?
Last 2 days, doctor.
2 days. Were you doing something that started it?
Yeah, I was just, helping my wife to pick the furniture up.
Um, do you feel that the pain is more during a particular time of the day?
No, it's all the time in the last 2 days.
All the time. What is the character of that pain?
It's a dull pain in the back.
Dull pain in the back. And could you please point out where it is?
On this side, doctor.
Okay. Is it radiating anywhere?
Doc, it goes to the leg.
Goes with it. Okay. Do you do something that would decrease this pain?
Just applying some balm or applying some gel, Mankey will help.
Okay. Do you feel that any posture you take decreases the pain?
When I bend, it gets better.
When you bend, it gets better. Okay. Do you feel that the pain increases when you are walking uphill or downhill?
When I when I come down, I have to really walk gingerly,
Okay.
and because the pain gets worse.
And do you feel that something you do would increase the pain, like except walking down?
Uh, I have to bend like this to walk to make it better. If I'm walking like this, it gets worse.
Okay. Do you have any previous episode of such kind of pain?
No, doctor.
Are you taking any medications for it?
No.
Okay. Do you have any other pain anywhere else? Okay. How's your sleep?
It's fine.
It's fine. Do you feel fatigued?
No.
How's your mood, Mr. Mani?
It's fine.
It's fine. How's your appetite?
It's fine,
It's
doctor.
fine. Do you experience any problems with the bowel
No, doctor.
or bladder?
No.
Nothing? Very good. So, are you up to date with your vaccinations?
Yes, doctor.
You're up to date. Okay. Did you undergo colonoscopy at the age of 50?
No.
No.
I don't believe in colonoscopies.
Okay. So, do you have any medical illnesses?
Just the blood pressure issues.
Are you taking any medication for it?
Diazide
That is right. When do you take it?
in the morning.
What is the dose of the medication?
I don't know.
Okay. Could you please let me know on your next visit?
Yeah.
Thank you. Have you undergone any surgery?
No, no.
No surgery. Okay. In anyone in your family, does they have similar kind of complaint?
No.
No. Or any high blood pressure, blood sugar? Okay. So I will be asking about your social history. Does anybody, what do you do for a living?
Oh, doc, I am a sales agent.
Sales agent. I'll be asking you some personal questions and I assure you they will remain confidential. Are you sexually active?
Yes,
Can you elaborate on your partner?
with my wife, doctor.
Do you have any past medical history of sexually transmitted diseases?
No,
Very well. Do you use alcohol in any form?
not exactly.
Tobacco in any form? Do you use any kind of recreational drugs?
Just marijuana.
Just one one, and can you tell me how many times you use that?
Just 1 or 2 times a day.
A day. Okay. So, Mr. Armani, from the history that you have given me, it seems like this back pain has been for 2 days and it's radiating to your right leg, and it also causes you problem when you're walking downhill. Do you have any other problem that I might be missing?
Just the pain.
Where?
Just the pain in the back, and that's it.
Okay, now I'll be physically examining you.
So the one main question.
Do you have any kind of numbness or tingling?
No. I have slight numbness and tingling. But what else? Whether it crosses the knee joint or not. The pain. Because if it crosses the knee joint, the C4, C5, S1. If it does not cross, then L1, L2, L3. And what else? Do you have any pain on the side or in the groin? Groin is arthritis, side is trochanteric like that.
Okay.
Do you have any pain over here? Okay. So what kind of exercise you do?
I do what exercise. Yes. Okay. So I'm gonna physically. I'm doing muscle kind of. Do you have any kind of pain? Do you have any kind of pain? Do you have any pain? Any pain? Okay. So can you please push up, push down? Okay. Now I'll be remove your socks, please. I'll be checking for your pulses. Okay. Can you please remove your socks? I will be checking your pulse. Okay. I'll be checking for reflexes.
Make sure you over your tuning fork. Okay, and your knee hammer.
I'll be checking for knee reflex.
Slower.
Sorry.
For me, it's fine. You have to always lift your leg.
Could you please lift your leg up this one? Okay. Are you? Can you see?
Are you what?
Cancel the sentence.
No, why? Why cancel the sentence? So don't speak if you don't know what you're asking. That's why you need to write. This is the reason I'm asking you to write 10 times. You will get in a problem. Are you? Cancel the sentence. How can you cancel? The words already came out of the mouth.
Are you? I was going to ask like, are you experiencing pain here?
So why are you not completing it? Complete the sentence. Do not leave it hanging. Okay.
And now I'm gonna examine for.
Look at the simple. I'm giving you very simple case. I'm giving it's a very simple case.
I know.
Very
know.
simple case.
Very, and the diagnoses are so clear. Either it's lumbar stenosis or sciatic or it's trauma muscle lumbars.
But still, you're doing mistakes. So you have to write 10 times. Your problem is ums and write 10 times, 20 times, 30 times. 1 hour a day you have to dedicate to writing sentences. You may be frustrated, but you have to write it down. Because you cannot just keep on saying the words. And so they will come to know. Do not say that. Okay, keep going, keep going.
Can you do your arms like this? Okay, push against this. Okay. Can you squeeze my fingers? Thank you. Now I'll be asking you to walk. Okay. That's it. Thank you. Can you please lie down? Now I'm going to raise your leg. Okay. Please tell me if you experience any kind of pain.
Yes.
Okay. Now I'm gonna rotate your legs inside. Do you experience any kind of pain? Sit up. Okay, can you push in, then push out? Okay. So the muscular skeleton of your legs seems fine. You have no numbness or tingling, and the strength is 4/5 normal, and the tone is also normal. The reflexes are symmetric on both the sides, and your gait is also normal. The straight leg tests that are performed caused you pain, so it might be indicating that you might be having sciatica. But
What happened with this straight leg raise? So you never did it. So if the pain is going in this side, can the pain happen on this side too? But you missed it. So look, very simple case can become so confusing. So I will teach you how to overcome this. So that's why there are two things you have to do in Houston.
right.
Write, and become an SP. And when you are becoming an SP, whatever mistakes there, you write it down, their mistakes. Write it down. Write it down. Be critical of them. Once you start becoming critical of them, you will learn a lot yourself, what mistakes they are making. Okay. So how will you explain me with the help of a picture?
So Mr. Mani, it seems like either you have a lumbar strain, or because you had been experiencing pain since the last 2 days after an exercise while lifting furniture. So for that we will be performing. Firstly, we will be starting from X-ray, but we will eventually go on to MRI. Your pulses are normal, which excludes any kind of vascular abnormality, and your
Draw. I don't get without the pictures. You have to draw and explain me what's going on.
so if we consider that you might be having lumbar stenosis, so so this is your vertebra, and
No, you have to draw.
so sometimes, like, either there can be increased, there's this ligament known as ligamentum flavum, which can increase in thickness and can narrow the outlet of your nerves, causing the symptoms that you're experiencing. You can lumbar stenosis, and this is one of the cause, and either lumbar strain. If
Okay, speak.
and for if there is any kind of increased pain that you might experience during the following days, you can apply balm on it, or I could give you ibuprofen or Tylenol to decrease the pain, and you can even decrease the exercise for a few days. I would not recommend you to go on a complete bed rest. I would recommend that you keep on continuing a little bit of exercise, but avoid any kind of strenuous exercises. And if you feel that your pain has been increases, you can always contact me and take my number from the front desk.
Will physical therapy help out?
Physical therapy can help.
Can it help? So yes, I will
yes.
refer you to physical therapist.
Okay.
So most important thing is, remember, picture is worth 1,000 words. What blabber will we do? They will not get. But once you start drawing the picture, Ahmed Javed was my student. He was my colleague also in MBBS. And because he was already a surgeon, he's a big shot surgeon, he came from a training. And he said the quote, he said this: every patient he made picture, and it was a night and day difference. He was able to explain in detail. Now, obviously, he's a surgeon, MCH from AIMS. Obviously, he will be explaining, but he said that drawing picture really helped. He's using still the same principles in Delhi. He did his fellowship, So I'm telling you, picture. Thank you for watching the video. Enroll now in our Lean Patient Experience Certification course, link in the description below.